project, which is community-based volunteering in response to COVID-19. I'm part of a team including the University of Kent, the University of Surrey, and Brighton and Sussex Medical School, and also our partners in the Applied Research Collaboration, Kent, Surrey and Sussex. So this research took place across those 3 counties, so Surrey, Kent and Sussex. I'm sure we're all aware of this, but we're all aware of the unprecedented increase in volunteering as a result of COVID-19 at a number of levels. So that's from the very highly localised neighbourhood schemes, faith groups, national organisations, which are long well established, such as Age UK, and also NHS initiatives such as the Good Sam app, for example. So I think the background kind of speaks for itself, really, and I suspect others will have similar kinds of motivations for the work that we're going to present today. So our target group for this research was those people who were receiving volunteer support, who were over 65 years of age and who were self-isolating or shielding as a result of COVID-19. So we asked, how can a community-based volunteer workforce be rapidly and safely implemented? And what is the impact on providing support for our self-isolating, vulnerable older people in our community as a result of COVID? So within that, we had a number of objectives. These are perhaps the 2 main ones. So we set out to explore the experiences and impact of COVID-19 through undertaking qualitative interviews with a whole range of people, stakeholders, if you like, who are part of that picture. So that included health and social care practitioners, the volunteer organisers who were organising, coordinating and supporting volunteers, the volunteers themselves, and also we spoke to older people who were receiving volunteer support during COVID. So our second key objective really was to develop a set of key messages for our patch, for Kent, Surrey and Sussex. So the community hubs, local resilience forums, health and social care organisations, the voluntary organisations themselves, and other community groups, really in order to facilitate safe implementation of volunteers' workforce. So that's the kind of focus of our study. We used a qualitative methodology, and we did this in 3 phases. So first of all, we undertook a rapid literature evidence review, really to see what the literature really had to say around volunteering, particularly in times of crisis, if you like. We also accessed and analysed a number of organisational documents, so policies and procedures, and we obtained these from the participating organisations themselves, but we also accessed information that was publicly available through the websites. We also then undertook the largest part of the work, which was qualitative, semi-structured telephone interviews with 85 participants. Some of those we did via Zoom as well, but most were done by telephone. So we interviewed 12 health and social care practitioners, and they were social workers, community nurses, those working in primary care, so a range of people working as professionals within the health and social care sector. We also interviewed 21 organisers, so we accessed the voluntary organisations in our patch and spoke to those people who are coordinating and organising the volunteer input. We spoke to 27 volunteers with a range of backgrounds and ages, and we also spoke to 24 older people who were receiving support from volunteers. And predominantly that was things like people having their shopping collected and delivered, prescription collection and delivery, meals delivery, dog walking, and also befriending, which actually was quite a large part of the volunteering that we came across. So a whole range of both individuals, but also types of support. So just to share some of our main findings, we're still sort of in the latter stages of analysis, so there's still a few things emerging. But what we found really is that good connections and communication between services was key. There were fewer gaps in provisions where organisations were able to work together identifying need and filling gaps. So for example, one organisation we spoke to pre-COVID did lots of social events, social groups, activities in kind of like leisure centres and halls for older people. That all stopped obviously as a result of COVID. So what they described as stepping back. So they stopped, they communicated with the other agencies around them and to see where the gaps were. So things like, okay, if you're up to capacity with meal delivery, tell us and we can step in. So in that way, they were able to kind of coordinate that activity at a local level. However, we also found that there were some tensions between different groups, particularly where new groups sprung up or where the local authorities stepped in to provide support, which other organisations had previously already been supporting. So there was also some kind of, I won't say competition, but there was certainly some tensions about who was providing what and who was treading on perhaps other people's toes in relation to that. There was clearly a desire to maintain that community spirit and to sustain this volunteering impetus going forward. But this was very much balanced against maintaining safety. And we had some real differences, some real variation in perceptions of risk and safety in relation to volunteering. So for example, some organisations said, well, we don't need to do really if any vetting and DBS checks, so disclosure and barring service checks, if people are doing befriending over the telephone. Other groups say, well, no, that's absolutely necessary. You still need those checks, even if it's over the telephone. So there's a real kind of different perceptions around that in relation to vetting and checking. Some people described kind of like getting rid of some of this, what they described as red tape, as quite liberating. But for others, it was cutting corners and was very much an area of concern. We spoke to our volunteer organisers about the concept of volunteer passports, enabling volunteers to move more freely within different organisations. Generally, there was a lot of support for that. However, again, there was also some concerns that if that was the case, then that vetting and checking needed to be what was described as the gold standard. So they needed confidence that that person had been properly checked, if you like, in terms of before they were able to provide support. Other key findings, and I'm sure this perhaps isn't unique, is this digital divide. So IT was both an enabler of support, but in our population of older self-isolating people, it was also a highly significant barrier. So we had quotes like Zoom. What's Zoom? I've never heard of it. I think we could probably all have said that before COVID. But so there was some older people felt further isolated because of the technologies and what was being proposed, like teleconferences with their GPs, and actually it became more isolating for them. But for others, it was absolutely an enabler. And so some organisations were able to do online quizzes, for example. But generally, it was largely a barrier described for most of our older people. There was something around the reciprocal value of volunteering, and that volunteers get as much out of volunteering as the recipients. And we found a link really between sustainability and this reciprocal value of volunteering. So for example, where volunteers were able to develop personal relationships with the person they were supporting, then they said they were much more likely to be able to continue that. So where people did not have investment, if you like, in particular individuals, then they said they were less likely to support. So for example, a lot of people we spoke to who were good SAM volunteers said they weren't going to continue because they hadn't built up that relationship. So there is something very much about personal relationships and the reciprocal value of volunteering.
Just 1 minute left. 1 minute left, Julia.
Thank you. Trust was a major issue between organisations. So in terms of implications for policy and practices, not a one-size-fits-all. So for example, befriending was taken up in some areas and not in others. So needs were identified and in some areas and not others. So it's very highly local, context dependent. There may be cultural issues. And so it's about knowing your population. digital connectivity and use varies among older people. So we need to actually address that issue going forward. One older gentleman said, wouldn't it be great if we had students who could come and help us to kind of work out Zoom and smartphones, etc. And I think that's really exciting from an intergenerational perspective. There's great potential to build on the increased volunteering. We've heard a lot about our own well-being and mental health needs as a result of COVID. And actually, because our volunteers get so much out of volunteering, there is potentially that benefit for people volunteering in terms of moving forward in well-being and mental health. And finally, just to finish up, partnerships are key, really, between those organisations. And these partnerships should be renewed, reviewed, revigorated, because we've got clear illustrations of capacity and competence. So we need to value this sector. One person described a whole army of people making 150 calls a week. We need to sustain that. And we need to recognise the impact, building on partnerships, providing adequate ongoing financial support, which is also vital. And I'll finish there, and that's probably perhaps a minute over. Thank you, Angela.
That's brilliant. Thank you, Julie. It's so difficult to get everything into 10 minutes, haven't we? That was a fantastic opening session for us. And that some of the key things I take from there around the importance of, you talked about partnerships there, but it's kind of relationships, isn't it, at organisational and individual level, and how important they are to volunteering and to the volunteering experience. So thank you very much for that, Julie. I'm going to move straight now on to our second presentation. If you do have questions for clarification, you can put those up as we go along in the question and answer box. If you've got broader questions, please do start putting them in the question box, and we'll address those at the end. So thank you for that. So I'm going to move now onto our second presentation, again from a team of people, but we've got here with us today so Harriet, Thiery and Jenny McNeill from the University of Sheffield are going to talk to us about, again, mobilising volunteers and effectively mobilising volunteers during COVID-19. So over to you, Harriet and Jenny, thank you.
Thanks, Angela. Can you see my screen without the notes? Are you looking at the right one?
Yes, we're at the right one. Thank you very much.
Great, thanks.
Hi everyone, I'm Jenny McNeill from University of Sheffield, and today Harriet and I are going to talk through the MOVE project, which is Mobilising Volunteers Effectively. And first we want to give you some brief background to the study. So the MOVE project builds on the work of the Enabling Social Action Programme, which was a partnership between the Universities of Hull and Sheffield and DCMS. And over the course of 2 years, the ESA programme supported local authority commissioners to co-design, co-produce and co-deliver services with local people and the voluntary and community sector to really help embed social action in their routine working. As part of the programme, we worked closely with 6 local authorities and hosted a number of national and regional events. We built up a large network of over 1,500 people from local authorities and VCSs. And what we learned from all this activity was the importance of changing organisational culture to be more partnership driven, but also the importance of sharing power through collaboration, co-production and community engagement, and creating shared spaces for cross-sector dialogue. But we also identified a number of barriers that often obstructed the process of doing things differently. In particular, at the level of the local authority, bureaucratic and risk-averse cultures led to restrictive practices. We also found that financial pressures led to traditional approaches using impact measurements, which were not always fit for purpose. And lastly, we saw how silo working creates a real barrier to working with partners and communities. Yet there's some really innovative approaches which can help overcome some of these barriers. And so when the pandemic broke, when the ESA programme was ending, we knew it was going to be really important to see how those systems reacted. So it's within this context that the MOVE project was formed and funded by UKRI. And over the course of 18 months, we'll build on some of this previous learning from the ESA programme and work with our network to understand how locations mobilise local community capacity and resources and started to change some of these relationships to respond to the crisis, examining the role of volunteers, local authorities and the voluntary and community sector, and crucially considering what lessons can be taken forward into the recovery phase. So the project's very new. It started end of May and we began interviews in June to get a really broad perspective of what community what the community response to the pandemic has looked like in different locations across England, Scotland and Wales. And to date, we've conducted nearly 50 interviews, but for today, our findings are based on data from 36 semi-structured interviews, as well as 3 webinars that we've so far analysed. For our interviews, we tried to get a good balance of different types of organisations, including local authorities and voluntary and community sector organisations. And we're starting to see a number of key themes emerging from the interview data. So firstly, around existing models. Within this theme, we're learning how the community engagement model that pre-existed COVID-19 shaped the approach taken in different localities. So local authorities with strong community engagement models appeared able to respond quicker during the lockdown. Pre-existing relationships between local authorities and voluntary and community sector have been vital and enhanced during the pandemic, with new relationships forming with mutual aid groups. Participants shared also how patterns of need have evolved over lockdown, with mental health and issues of poverty becoming increasingly prominent. We're learning how localities have recruited and utilised new and established volunteers to meet community needs. What we're seeing coming up again and again is how the pandemic has created valuable learning that organisations are keen to build on moving forward into the future. And the crisis has produced an expanded sense of community commitment to volunteering, social action and good neighbourliness. And pandemic responses have broken down some of these systemic barriers for new ways of working and collaborating. Participants emphasise the need to harness the momentum for future recovery, but we're also hearing a lot about the impending challenges that present both a threat and an opportunity to embedding this learning. So these are some of the key themes that we've started exploring in our data, and we plan to explore these themes in more detail as data gathering continues. But today we just wanted to share some of the headlines from what we're learning so far about models of response and some of the key learnings that participants have said they want to take forward and embed in the future. So I'll pass you over now to Harriet, who will go through these in more detail.
Thanks, Jenny. So from our interviews, the team is working on a typology of models of response at the level of the local authority, and we're still refining these as we gather more data, and we will be publishing this in the coming months. But what's been common across all the localities is a multi-agency community-focused cell of local authorities, public sector bodies like CCGs, and voluntary sector organisations, all coming together to coordinate a response to the needs that emerged in communities at the start of the pandemic. So those shared spaces for cross-sectoral dialogue that Jenny talked about that are so important were instantly created all over the country. And one infrastructure organisation told us that at the start of lockdown, they were in meetings daily from 9 till 5 as part of this cell, and they described how they'd been invited into the big tent. So we've identified 3 different models which describe the variation in how these strategies are then fed down into communities. So the first is where the response cells use the local infrastructure organisation for the voluntary sector as the primary coordinator for volunteer mobilisation. In the second model, the response cell channels support through a series of hubs. So these are either existing organisations or sometimes they've been new hubs, but the council links them into the overall strategy, allowing them to coordinate a more localised response. And the third model is a more multi-agency approach in which the response cell feeds into existing community networks and systems. So in these locations, the council undertook more of a coordinating role, not in a controlling way, but as an enabler and a partner. And what we're keen to understand is what are the different factors influencing these chosen models. So we're looking at the existing relationships with voluntary organisations, the level of authority of the council, and the level and types of community engagement that pre-existed COVID. So we're in the early stages of exploring some of these models and questions, but we anticipate that they will offer some interesting insights into how pre-existing conditions have been enablers or barriers to an effective response. So what we've heard time and time again is how during the pandemic, the pressure to respond quickly to community needs meant that many of the barriers that organisations typically come up against when trying to enable social action in communities were dismantled. So we're hearing how traditional aversion to risk was swept away by the pressures of the pandemic, allowing community development staff to implement plans really quickly and effectively. So one person described how bureaucracy moved out of the way and we were given permission to go ahead. And another said about strategic documents, we batted those off because we just got on and did the do. So this relaxing of bureaucracy has led to greater relational working, which has enabled data sharing, which was so crucial for everybody who might need support to be reached. And one person described how COVID saw walls come down in this regard. We've heard how the organisation of funding underwent radical changes as well. So flexibility and trust has replaced regulation as the fundamental principles underpinning the process of distributing funds. So special payment processes have been put in place to get funds out quickly. And so grassroots groups were able to access resources without needing constitutions or memorandums of understanding like they typically would. So the traditional caveats were removed and resources were able to follow the energy. And that's because, and this quote from one of our participants summarises it nicely, the very nature of the lockdown meant that the response had to be place-based rather than sector-driven. And another lesson that's been really important is that organisations that had already been working to embed more relational, trust-based working pre-COVID were able to build on those foundations, and the process of stripping back bureaucracy was far simpler and more effective because they already had in place the key ingredients. They'd spent time understanding the infrastructure and the resources of their communities, and they built trust, which enabled groups to respond quickly. So there've been some key lessons from the period, and what our data has shown us is what happens when the usual caveats, ifs and buts, thanks Angela, that prevent more trust-based, collaborative, integrated and place-based working are removed. So in all those areas where the walls came down, authorities felt that it was really key to their capacity to respond effectively. And this suggests that we're going to need to continue this approach as we move into the future. But some organisations are already seeing some of those bureaucratic structures creeping back in because of the pressures that they're facing. So we've heard about a pending cliff edge, which is caused by several coalescent factors. And these relate to central and particularly local government finance and policy, which we've heard a bit about today. So several local authorities described how the deficits that they'd already been carrying had been extended as a result of the crisis, and they expect knock-on consequences for commissioning, including cuts and redundancies, which means they won't be able to sustain the level of funding that they've maintained during lockdown. Voluntary sector capacity is a key factor. The voluntary sector faces reduced grant funding from local authorities, an inability to generate income through trading because of social restrictions, and some of them are worried about volunteers going back to work, and an increased demand on their services. So because COVID has both shone a light on and exacerbated the already existing challenges of poverty and inequality and created some new disadvantaged groups, people who weren't previously known to services but are facing redundancies and a dwindling job market. So how can we retain the new ways of working that have been fundamental to responses, to successful responses? Everybody works well in a crisis, but one of our interviewees said to us, everyone's saving the people, but once the people are fine, you're back to saving your own organisation. And this means that making the case that it was the stripping back of bureaucracy, the letting go, the partnered working, the trust in communities that was key to success is crucial, because without deliberately building these changes in, they might well slip away. And this is something that we're going to explore in more detail in the next stage of our project as a small contribution to this effort. And we'd like to thank the rest of our research team at the Universities of Sheffield, Leeds and Hull, as well as our participants. And we'd love to hear from you. So here are some ways you can get in touch. Thank you. Sorry for going over.
Not at all. Brilliant. Thank you so much, Harriet and Jenny. That was another fantastic overview for us. Covered a lot of ground within a short presentation, so thank you for that, and it'll be interesting to find out more about the research as time goes on. I think that kind of the stripping back of bureaucracy is a really interesting one, isn't it? But also the differences, the importance of place and the differences then between places, and whether that is how we can kind of begin to understand some of the differences between places. So thank you for that, and I'm sure there'll be lots of questions and discussions for you to pick up on those afterwards. Thank you. Jurgen, any quick questions or clarification, or can we move straight on?
I think it would be best to move straight on.
Brilliant, thank you. So we'll save the questions till later. So moving on to our third session now. So we're moving from England on the whole, I think, so far to Scotland to hear from Alan Stevenson and Debbie Maltman from Volunteer Scotland, who are going to talk about the lessons learned in managing the supply of volunteers during COVID in Scotland. So over to you, Alan and Debbie. Thank you.
Okay, thanks, Angela. Yeah, we're going to talk about the lessons learned from 3 survey perspectives. So I'm Alan Stevenson, I'm IT and marketing manager at Volunteer Scotland, stepping in really as, for the research manager. But I do spend a little bit of time with the stats, but not anywhere near as much as Debbie Maltman does, as the research officer at Volunteer Scotland. So our structure of our presentation is around, first of all, we'll talk about impact on volunteer participation from one key survey, look at the impact on organisations, and then draw implications for recovery and also post-recovery. So we're drawing really from 3 data sources for Scotland. There's the Oscar Charities Survey. It's an online survey which was conducted between 5th and 15th of May. Had a sample response of 4,800 or so organisations, and represent a population of almost 25,000 registered charities across Scotland. So it's a pretty representative cross-section of charities. We've got a TSI Network Survey, which was an online survey conducted April and May to just over 1,000 organisations. That's representative of 32 local authority areas, but also the third sector, so it's voluntary organisations in there, as well as smaller community groups and social enterprises as well. And then we have the Ipsos Mori Omnibus Survey, and that was a telephone survey which we conducted in June. And it focused on the three stages really. So before COVID, looking almost a year before the lockdown, then there was the during COVID period, and then there was also their views really in terms of after COVID. So that went to 1,014 adults. Adults aged 16 plus in Scotland, and it was weighted to ensure a representative sample. So just pass across, and Debbie will talk us through the results.
So the first set of results we're going to consider is the supply side, and that's the impact of COVID-19 on volunteer participation. In Scotland, we've seen a 29% increase in overall volunteer participation, from 45% pre-COVID to 74% during COVID. And that means that almost 1/4 of Scottish adults have undertaken some type of volunteering activity during COVID, which is pretty incredible. After COVID, we expect participation rates of 59%, and that's 14% higher than what we saw prior to COVID-19. If we move on to look at the different types of, back Alan, please.
Sorry.
Types of volunteering. Formal volunteering has seen the biggest decrease. Formal volunteer participation rates have dropped to 11%. That leaves us with a formal participation rate in Scotland of only 13% during COVID-19. We know that there's lower rates of formal participation in the most deprived areas of Scotland, and this has been exacerbated by COVID-19. Formal participation and formal volunteer participation has been much higher at 35%. And this actually may be a conservative estimate, as 32% of our Ipsos Mori respondents didn't identify with any of the types of volunteering, but they did say that they've done at least one volunteer activity type. So actually, when we think of the informal volunteering at 35%, we really could be looking at a much higher level. Mutual aid participation has stayed the same at 16%, but has become much more prominent in terms of getting involved in the COVID responses in Scotland. If we move on to look at the activities undertaken during COVID-19, informal volunteers have provided a disproportionate response in areas such as befriending, food shopping, helping with household tasks and gardening. Informal volunteers have been doing more general help. They've been stepping in to meet the immediate needs of individuals in the communities. Formal volunteering, on the other hand, has led the response in supporting those facing challenges, providing food support other than shopping, supporting people's physical and mental health, and providing administrative or IT support. They've been dealing with the more complex needs during COVID. The findings from the Ipsos Murray survey that we undertook, it ties in and is supported by a vast amount of qualitative evidence that we've gathered on the amazing volunteer activities undertaken by both formal and informal volunteers during lockdown. Now we know the activities undertaken by volunteering during COVID-19 and lockdown, how do these relate to the issues that we're seeing in our communities now? The top issues of concern for communities now include mental health, loneliness, loss of income and increased poverty. Loss of income and increased poverty will become bigger issues during an economic downturn, but the issues of mental health and loneliness aren't going to go away. We now come to the demand side and the impacts of COVID-19 on organisations. Specifically, we're going to look at the number of volunteers engaged by charities. So 41% of Scottish charities have decreased their volunteers. A quarter of charities in Scotland, that's been a major decrease. Only 7% of charities have increased the number of volunteers, and only 2% majorly. It's interesting to note that 85% of charities surveyed in the Oscar Charity Survey have 10 or less staff, and 54% have no paid staff. They're completely volunteer run. Almost 50% of charities involved with the environment and animals have decreased volunteers, and proportionately more charities involved in social care, people with disabilities and mental health have had to decrease volunteers. If we think of it, 35,000 Scottish people signed up to Scotland Cares to offer volunteering support in Scotland. But when we looked at the TSI survey, 7% of third sector organisations are struggling to recruit volunteers. That's mainly in services targeted towards people with autism, people with learning disabilities, and people with care experience. So we need more expertise in certain areas. If we think back to the previous slide, the areas of greatest concern for right now are mental health, loneliness, and loss of income. But we can see that formal volunteer numbers in these areas have fallen. So what does this mean for the future, and what are the implications? And I'm going to pass back to Alan to highlight some of these.
Okay, thanks, Debbie. I mean, I think the first thing to mention there, and it was mentioned in the previous presentations, is really the contribution of informal volunteering. And within Scotland, that's certainly driven an increase in the overall volunteer participation during COVID-19. So that help out in an informal sense has been a disproportionate response around things like befriending, helping out with household tasks, gardening, collecting prescriptions, and so on. So that's been very valued, very valuable in terms of the support it's provided. But what we shouldn't forget is that formal volunteering provides a greater degree of support to those sort of more complex areas, and that's supporting challenges like people's physical and mental health. And of course that aligns with really what the subsector is saying around where the need is moving forward, and also where formal volunteering has the biggest role to play. So mental health, loneliness, loss of income, increased poverty were all areas that were mentioned prominently. Access to food was kind of further down the list, if you like. I mean, another key point there about formal volunteering is, I suppose, is the low level of formal volunteering during COVID, and that's exacerbated when you start looking at areas of deprivation. So if you look at that in terms of quintile 1 and 2, you'll see sort of even less around formal volunteering effort, and even greater in terms of the needs in those areas. And then on top of that, I suppose, is really what's happening around the charities. The charity sector, as Debbie mentioned. So, you've got up to half of charities have seen their volunteer numbers decrease, and certainly some key areas again around the crisis: social care, people with disabilities, mental health charities have seen certainly increased levels relative to other sectors of charity. So it's you know, it's without a word of lie that COVID has had a detrimental impact on volunteer capacity within the charity sector. We assume that if we were to run a survey of this type within the third sector, we'd see similar results as well. So although we're talking very much about opportunities for volunteering and a great volunteer response, I think it's important to remember when we look at the recovery and how we fully recover from the impact of coronavirus, there are key capacity issues around the formal volunteering sector that need to be addressed. And this, according to our findings, goes further than just notions of supply and demand and numbers. It goes into the very viability of the organisations themselves. And again, the Oscar survey provides some results in that front. 85% of charities face some threat in the next 12 months. 20% a critical threat, so they're really thinking about whether they can continue. And I suppose the other thing that's important to note is that 85% again of charities have 10 or less paid staff, and 54% of charities are actually voluntary run. So services would disappear entirely. And I think that's us. Thank you.
Unmute myself. Thank you both very much. That was fascinating to hear. Absolutely great to have the some data on the levels of volunteering, which we just don't think we have such good kind of data in England. Definitely, I'm not sure anywhere else. So thank you for that. One quick question for clarification that has come out. So I'll just ask you this very quickly now. And I certainly don't want us to enter into a big debate about the difference between formal and informal volunteering, etc., because we could discuss that for the rest of the session. But could you very briefly just tell us how formal and informal volunteering are being defined in this work, and particularly a specific question has been asked about whether informal just relates to, did it include help to family and friends, or was it explicitly not? Yeah, so just briefly how it was defined, please.
So across the surveys, formal volunteering is defined as volunteering through a charity or organisation. We excluded volunteering for friends or family from the informal definition. I know that there's some YouGov surveys out there that have included that, but we've purposely excluded it so that we're comparable to the Scottish Household Survey, which is our main source of data for formal and informal participation rates within Scotland, out with the exceptional circumstances that we have at the moment with COVID. Brilliant.
Thank you very much indeed. Thank you. That's really helpful to have that clarification. So there's lots of questions now coming through on the question and answer, which is fantastic. We should look forward to discussing that those questions in a moment. But without further ado, I'm going to move on to Emma Taylor-Collins and to Fiona Liddell, who are going to talk about the experience in Wales. So the pandemic recovery and volunteering in Wales. So I think both Fiona and Emma are going to speak, so I'll allow you to kind of introduce yourselves as you do so. But over to you. Thank you very much.
Thank you very much, Angela. I'm Fiona, and in preparing for this, Emma and Hannah and myself spent a bit of time reflecting on the many conversations and events and meetings that we had attended about volunteering and the pandemic, noting the emerging themes and issues. And what we found through this analysis was that a question was raised that we want to focus on, and that is, what are the preconditions that seem to have aided the volunteer response to the pandemic in Wales? Now, separately, about 50 case studies on volunteering and COVID-19 have been collected by WCVA, and 6 of those were selected for us today to represent a range of volunteering, both within community groups and within statutory organisations, and illustrating different histories and partnerships. So we're going to share some of those briefly and to highlight some of the enabling factors that seem to lie behind the stories. Now, national policy is one important precondition for the kind of volunteering response that we've seen. In Wales, the Wellbeing of Future Generations Act is groundbreaking legislation which places a legal obligation on public bodies to plan and to monitor progress against 7 wellbeing goals and 5 different ways of working. A Healthier Wales is the long-term plan for health and care, which includes this commitment to support and invest in the development of the health, social care and third sector workforce including volunteers. Prosperity for All includes this commitment to identify opportunities for more people to volunteer, including within health and care. And Volunteering in Wales, lastly, is the Wales-wide volunteering infrastructure comprising CVCs, county voluntary councils in each county, and WCVA at a national level, Wales Council for Voluntary Action. Together, they manage the volunteering website and a range of volunteering support services. So the policy context in Wales anticipates and relies upon local coordination of volunteering and joined up services with more volunteers supporting health, care and well-being. So here are some examples in which volunteers provided intentional support for statutory services. In Denbighshire County Council early recognised the need for additional capacity in order to meet the needs of shielded and vulnerable people. And from the outset, it discussed with the local county voluntary council how volunteers might help. The CVC was best placed to set up and to run a referral scheme for coordinating a community volunteer response. Volunteers were recruited via the Volunteering Wales website and either referred to other organisations, or they were matched through this new referral scheme with requests for shopping, prescription collection, dog walking and so on. So in this way, the community response was organised in line with safe practice and linked in with the local voluntary and statutory provision, ensuring the best use of volunteer resources. Blood Bikes Wales is one example of a volunteer-led initiative which now works in formal partnership with health boards, transporting blood and other items at the request of the NHS.